The 4-7-8 breathing technique involves breathing in through the nose for 4 seconds, holding your breath for 7 seconds, and exhaling through the mouth for 8 seconds while making an audible whooshing sound. This method may be beneficial for calming feelings of anxiety and helping people to fall asleep. Not many high-quality published studies look specifically at this technique's effect on lowering blood pressure. However, one small study found that the systolic blood pressure was slightly lower, 3 to 4 millimeters per hour per gram, after participants performed the 4-7-8 technique. Diaphragmatic breathing, sometimes referred to as belly breathing, is a technique that involves slow, deep breaths. This practice activates the diaphragm, which is a muscle that sits between the lungs and the abdomen. Start by placing one hand on the belly and one hand on your stomach. Take a deep breath and focus on keeping your chest still while expanding your stomach. Aim for counts around 6 seconds for inhalation and 6 seconds for exhalation. Studies suggest that diaphragmatic breathing may help those with lung diseases like chronic obstructive lung disease and asthma. Fewer studies have looked at its effect on blood pressure, but one study found lower blood pressure after diaphragmatic breathing sessions, particularly when combined with mindfulness exercises. This technique involves breathing into one nostril while the other is held closed and then alternating nostrils. There are various patterns for performing alternate nostril breathing. One technique is to hold the right nostril closed while exhaling and inhaling through the left nostril, then switch to hold the left nostril closed while exhaling and inhaling through the right nostril. Research has shown mixed results on the effect of nostril breathing on blood pressure, though some studies demonstrated a decrease in blood pressure in adults with hypertension. Box breathing, also known as tactical breathing, is a technique that involves breathing in, holding the breath, exhaling, and holding it again for the same amount of time, such as 4 seconds. It is taught to military members due to its effect on enhancing performance during stress. However, there is a lack of high-quality research on its blood pressure lowering effects specifically. Equal breathing, known as samavriti, is a practice that involves breathing in for counts, such as 4 seconds, then exhaling for the same number of counts. This is similar to the box breathing technique, though it does not have the pause after each inhale and exhale. Breathwork techniques with slow breathing can lower stress and temporarily lower blood pressure. Still, evidence does not support that one breath ratio, duration of inhale versus exhale, is better than another. One small study of 10 people on dialysis for chronic kidney disease found lower blood pressure in those performing samavriti between dialysis sessions. Pursed lip breathing is a technique in which a prolonged exhalation is performed through pursed lips. To perform pursed lip breathing, inhale slowly through the nose for 2 counts and exhale slowly for 4 counts, blowing air through the lips in a puckered position. The American Lung Association describes pursed lip breathing as a technique that can help people with lung disease who are experiencing shortness of breath. One randomized control trial looked at the effectiveness of pursed lip breathing in patients undergoing emergency room treatment for hypertensive urgency. The group of patients who performed the technique for 15 minutes each hour had significantly lower blood pressure after 3 hours. IMST is a special form of breath training that uses a device to provide resistance to inhaled air. IMST is performed by breathing through a small handheld device. This makes you have to work harder to breathe air into your lungs. Breathing in this manner helps to strengthen the muscles between the ribs and the diaphragm. A small study of adults with elevated blood pressure showed that people who practiced IMST using a device providing high resistance had lower systolic blood pressure compared to a group of people using a sham or fake device that did not provide resistance. Systolic blood pressure dropped by 9 millimeters per mercury after 6 weeks of performing IMST for 30 breaths for 6 days a week.